Hi, everyone. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about another simple cause for fatigue, for low energy levels, and a host of other things, and that is iron. And I'm sure you've heard about good things about iron and bad things. Some places you read that you shouldn't take iron supplements because it can hurt you, and in other places you read, well, actually, you should take iron. Some multivitamins have iron and some don't have iron. So there's a wide range of information on this, so I'm just going to talk to you briefly today on clearing that up. So when patients come in and we do an initial evaluation, one of the most common things I see, especially in women, is low iron levels. And some of those symptoms include not only fatigue, weakness, low energy, but a lot of brain symptoms like anxiety, for instance, brain fog, lack of focus, concentration, and memory, restless legs, dizziness. So also on the other hand, you can get a lot of physical symptoms as well. Besides low energy, you can get cold hands and feet, oftentimes pale skin, weak and brittle nails. It can even eventually lead to hair loss. That's one of the biggest complaints that we see related to low iron is hair loss. A lot of women can come in complaining of that, and we check their levels and they have low iron. That's a very significant cause of that, which we'll get into in a little bit. Other things, heart palpitations are another common sign of iron deficiency, and it's something that's quite overlooked. So eventually, if your iron levels are low enough, it can lead to anemia, which is low hemoglobin, hematocrit, or red blood cell count. So all in all, it can just lower the level of oxygen available in your body, in your cells, in your brain, which is why it causes all these different symptoms. And one of the a recent case I had, which illustrates all these points pretty well. A woman in her 30s came in a while back, and she was complaining of fatigue, weakness, shortness of breath. She was having a hard time working out. She worked out regularly, and she was just having a hard time getting through her workouts. She also had heart palpitations, lack of focus, cold hands and feet, irritability, anxiety, and one of her biggest complaints was hair loss. Her hair was falling out in clumps, and she had no idea why. She had been to a number of doctors. No one can really find anything wrong related to all these symptoms. Finally, she went to a doctor that did a comprehensive testing and gave her, recommended some supplements, including iron, but there was really no follow-up, retesting. So she took them for a while, and then that was it. So she was feeling pretty miserable. So after getting her test back, one of the things I check for is ferritin levels, and that's a really important test to get checked because that tests the level of iron, your stored iron in your body. So you don't want to just get an iron test, which is just a brief moment in time of the iron levels in your blood, but a ferritin test, which again tests the levels throughout the tissues in your body. So the thing is, when you get this test, the lab levels are anywhere from 10 to 400, like the normal reference range, say is 10 to 400. So if you can get your doctor to order it, which is not ever routinely ordered, they'll look at it. Oh, if you're 11, you're considered quite normal and won't even pay attention to it. Well, actually, 10 to 400, depending if you're a man or woman, these ranges vary, is just ridiculous. I mean, so basically, they're saying if you're 399, you're okay, and if you're 11, you're okay. And it really doesn't make any sense, because actually, there's more. I go by optimal ranges, so I think the optimal ranges are between, say, 60 and 90. So the fact is, when you're below 50, 40 in ferritin, that's when you can start to get a lot of symptoms. Like hair loss starts typically when your levels are below 40. And it may say completely normal on your labs, and yet you're getting all these symptoms, including hair loss is one of them. So it is important to be aware of these reference ranges and what's ideal and treat accordingly. So with this particular patient, I put her on a comprehensive nutritional program diet, our diet I call the free diet. Had her start on that along with a number of different supplements according to her lab tests, and iron being one of them, since she was at a level actually below 10. She was in the single digits of ferritin. And there's other tests we check too with iron. There's iron saturation and total iron binding capacity. But anyway, ferritin is the one we're focusing on. So she was in the single digits, and over a month, when we did follow-up testing, in a month, her levels had over doubled, and a lot of her symptoms were actually going away at this point. And then we continue to do follow-up testing, and now she's in her 4th month. Her levels are probably, her levels are about five times, about 400% higher than they were. So she's getting there. It takes a while to gradually build up your iron stores. And this week, actually, I saw her for the first time, her hair actually stopped falling out. So it does take a while to build up your iron stores, but when it gets to that point, then the hair loss stops, and at a certain point, then it starts growing back. So what's really important is not to just get a test and take some supplements and then think you're okay and then stop because you feel a little better. It's really important to test and follow up and then retest, and then to make sure you're taking the right dosage and you're staying on it long enough. And then when you get high enough, then we taper down, and sometimes you don't even need to take a supplement after that. So she was really happy. Almost all of her symptoms completely cleared up, and some are still improving and getting there. Along these lines, you want to make sure your iron levels aren't too high. So if we do a test and someone's ferritin levels are too high, say they're 200, 300 or more, and they might even be within the normal ranges, but they can get too high, and that can cause, guess what? Almost all of the same symptoms as low iron. So you don't want to just run out after seeing this because you have hair loss or fatigue or brain fog or heart palpitations and just take a bunch of iron. You definitely need to test and retest and make sure you're on the right levels, if any, even if you need it at all. So if you are too high, that's a whole other protocol. There's a way to eliminate excess iron, which we're not going to talk about now, but you want to make sure iron's one of those things that you don't want to just take indiscriminately. So it can be great for you, or it can be harmful depending on what your levels are. So as far as the type of iron supplement, I recommend iron glycinate that we use, our natural medicine formulas line. It's bioavailable, it's non-irritating. So a lot of iron supplements that you buy are very irritating to the GI, to the stomach, cause constipation, and just aren't absorbed very well at all. So I like it. I really love this iron because it's bioavailable. It's absorbs really well, it's non-constipating, and our patients do really well with it. So we'll go ahead and put a link there if you just want to take a look at that and get a little more information on that. But I definitely would encourage you, if you haven't already, to get your levels tested. If you need any help, let us know. Otherwise, through your own provider, get the proper testing done. And if you have any questions on this or comments, feel free to contact us. Leave a comment below. And also, if you want to check out our website, nmcwellness.com, you can opt in for our regular newsletters that we send out on different health topics. So thanks again for joining me today, and look forward to seeing you next time. Take care.